Autism, or autism spectrum disorder, is often discussed as if it were one simple thing. In reality, it is a broad neurodevelopmental condition that affects how a person communicates, interacts, processes sensory information, and responds to change. Some autistic people speak fluently and live independently. Others may use few or no spoken words and need support throughout the day. What connects these different experiences is not one single behavior, but a pattern, differences in social communication, a strong need or preference for predictability, focused interests, repetitive behaviors, or unusual sensory responses. Autism is not something that suddenly appears in adulthood, even if a diagnosis happens later. Its features begin in early childhood, though they may become more obvious as social and daily demands increase. One core feature of autism involves social communication and interaction, but that phrase can be misunderstood. It does not mean autistic people lack feelings, do not want relationships, or are unable to care about others. Instead, it means that the usual social signals many people rely on may work differently. Eye contact, facial expressions, tone of voice, turn-taking in conversation, body language, or unspoken social rules may be harder to read, less natural to perform, or simply less meaningful. An autistic person might communicate very directly, miss hints, struggle with small talk, or find group conversations exhausting. For some, speech itself may be delayed or limited. For others, language may be strong, but social interpretation remains difficult. Another important part of autism is the need for predictability, routine, or sameness. This can show up in many ways: following a strict schedule, eating the same foods, taking the same route, arranging objects in a particular order, or becoming distressed when plans change suddenly. From the outside, these behaviors may look rigid. But from the inside, routines can create safety in a world that feels overwhelming, confusing, or too fast-moving. Repetitive movements, sometimes called stimmying, can also serve a purpose. Rocking, hand movements, repeating sounds, or fidgeting may help regulate emotion, reduce sensory overload, or express excitement. These behaviors are not automatically problems; they become concerns mainly when they cause harm or block daily functioning. Sensory processing differences are also common. An autistic person may be unusually sensitive to sounds, lights, textures, smells, tastes, temperature, or touch. A buzzing light, scratchy clothing tag, crowded cafeteria, or unexpected siren can feel not just annoying, but physically unbearable. Others may seek intense sensory input, such as deep pressure, spinning, bright visuals, or strong flavors. Many people experience a mix of both. These sensory differences can shape daily life in major ways. A child who melts down in a grocery store may not be misbehaving; they may be overwhelmed by noise, movement, lighting, and smells all at once. Understanding sensory needs can turn judgment into practical support. Autism is called a spectrum disorder because it does not look the same from person to person. The word spectrum does not mean a simple line from mild to severe. It is more like a profile with many dimensions: communication, sensory sensitivity, learning, motor skills, daily living skills, anxiety, flexibility, and support needs. One person may have strong academic ability but struggle with eating, sleep, or social stress. Another may need help with communication but have remarkable memory or pattern recognition. Support needs can range from occasional accommodations to full-time care. This variety is why assumptions can be misleading. Meeting one autistic person does not tell you what all autistic people are like. A formal autism diagnosis requires professional assessment. Clinicians look for patterns in early development, current behavior, communication, social interaction, restricted or repetitive behaviors, sensory differences, and how much these traits affect daily life. Importantly, a diagnosis is not based only on being shy, socially awkward, highly focused, or preferring routines. The characteristics must create significant challenges beyond what would be expected for the person's age and environment. Assessment may include interviews with caregivers, observation, developmental history, questionnaires, and evaluation for other conditions. For adults, diagnosis can be more complex, especially if they learned to hide traits, had limited childhood records, or were previously misunderstood as simply anxious, difficult, or gifted. Autism diagnoses have risen noticeably since the 1990s, but this does not mean autism itself suddenly became common. A large part of the increase comes from broader diagnostic criteria, better awareness, and improved access to assessment. In the past, many autistic people, especially those without intellectual disability or those who used speech, were overlooked. Some received different labels. Others received no explanation at all. Schools, healthcare systems, and families have also become more aware of developmental differences. The World Health Organization estimates that about 1 in 100 children were diagnosed between 2012 and 2021, with an increasing trend. Studies suggest a similar share of adults might meet criteria if formally assessed. Autism is highly heritable, meaning genetics play a major role. But there is no single autism gene. Instead, many genes appear to contribute, each influencing brain development in different ways. This helps explain why autism can run in families, while also appearing differently among relatives. Environmental factors seem to play a smaller role and are thought to be mainly prenatal, meaning before birth. Autism is also diagnosed several times more often in boys than in girls. However, that difference may partly reflect how autism has historically been recognized. Girls and women may be more likely to mask their traits, copy social behaviors, or have interests that are not seen as unusual, leading to delayed or missed diagnosis. Autism often occurs alongside other conditions, and these can shape a person's life as much as autism itself. Anxiety and depression are more common among autistic people, sometimes because of social stress, sensory overload, bullying, isolation, or years of feeling misunderstood. Attention deficit hyperactivity disorder, or ADHD, is also common, which can add difficulties with attention, impulsivity, organization, and emotional regulation. Epilepsy occurs more often in autistic people than in the general population. Intellectual disability is present in some autistic people, but not all. Recognizing these co-occurring conditions matters because they may need their own support. Treating anxiety, seizures, sleep problems, or ADHD can greatly improve quality of life. There is no cure for autism, and many autistic people and advocates do not see autism as something that should be erased. Support is usually focused on improving quality of life, communication, independence, safety, and participation. Therapies may help with language, social understanding, self-care, emotional regulation, daily living skills, or adapting to school and work. The best support is individualized. What helps one person may not help another. Medication does not treat the core features of autism, but it may be used for co-occurring difficulties such as anxiety, depression, irritability, ADHD, or epilepsy. Effective care also means listening to autistic people themselves, not just trying to make them appear less autistic. Support is not only about changing the autistic person. It is also about changing environments that create unnecessary barriers. A classroom can offer visual schedules, quiet spaces, clear instructions, and predictable routines. A workplace can allow noise-reducing headphones, written communication, flexible lighting, or reduced social ambiguity. Public spaces can provide sensory-friendly hours or clearer signage. These changes can make a major difference without lowering expectations. In many cases, the problem is not that an autistic person cannot participate, but that the setting was designed around only one style of communication, attention, or sensory processing. Reducing barriers allows strengths to emerge more clearly. The way society talks about autism is changing. The neurodiversity framework views autistic traits as part of natural human variation, not simply as defects. This perspective has been important in the autism rights movement, pushing for acceptance, accommodations, and respect for autistic voices. At the same time, the debate is complex. Some autistic people need extensive support, and some families worry that focusing only on acceptance may understate serious daily challenges. Others argue that treating autism only as a disorder ignores identity, dignity, and strengths. A balanced understanding can hold both truths. Autism can involve real disability and real difference. The goal is not to force every autistic person into one story, but to build a world where their needs and humanity are taken seriously. If you found this helpful, please like this video and subscribe for more explainers.